So is there even a chance that private sector can actually directly order or import vaccines, which is what the PCCI is urging the government to do? And a couple of doctors, including Dr. Cabral, who was former health secretary, is there a chance that this is possible?
First of all, I don't think the pharmaceutical companies will do it. No? In the earlier discussions with AstraZeneca, when we signed with them, it was mandatory that the tripartite be formed. One, because of the indemnification that protects both pharmaceutical company and the private sector. Number two, under EUA, the government should be the one owning the doses. So if you look all over the world, the countries, the governments are the one importing the vaccines. It is only in the Philippines that the government has allowed us to partner with them and for us to buy our own vaccines. So that's unique. That's never done in the world. The question is, why is the private sector doing it? Yes. Why don't we let the national government just do it? Well, I'd rather already secure my vaccines, earmark that quantity so that I'm sure that our employees will be having those vaccines. And it just gives us that comfort level that we already have the vaccines of our choice. No? So we were able to choose AstraZeneca and all that vaccines.
Right, but I guess the question is arising from the fact that they find the supply too slow, that they can't wait, that they feel at least that they can facilitate the process and get the vaccines earlier than scheduled by the government. Is that validated by your negotiations or by what you know so far?
You can see very well, no? In the case of AstraZeneca, we were very fortunate to acquire vaccines and be the first, no, last year, no, in November 27, documented, paid for. But the risk of us doing that, the first group, we purchased 2.6 million. We had to fork in a couple of 100 million. We had to sign a document that says that if, for whatever reason, AstraZeneca will not get their FDA approval, which they call MHRA, that our deposit will be compromised. Now, these are major conglomerates. And so we all agreed that let's take the risk. And we did, and it paid off. But I don't think the country or the government can do that. We have laws that prevent them from doing that. Other countries, wealthier nations, what they do is they donate or advance purchase and all of this stuff. And America controls three or four vaccine producers. No? So the Philippines is not as rich as these countries. But in fairness, if you look at it, even in Moderna, where Ricky Arzon, together with the government, secured 20 million doses, the 8 million went to the private sector also. So yes, we are able to get the vaccines for the private sector, and we buy that security that we already have an allotment. No? And so with Novavax and the rest. No? So what I'm trying to say is that the supply is very tight all over the world. Now, private sector can move faster because it's our money. But the government has to go through a whole process and respect the laws of the country. And that's what ties Secretary Galvez. But despite that, he's able to do it. No, of course, with certain challenges. But there's a big difference with owning your own company and throwing your money and buying these things. No?
Well, sir, Ambassador Yuiko was telling us last week about, of the PCCI, was telling us last week about missed opportunities, using his words, from 2 months ago when we could have gotten a lot of doses from Bharat in India at a cost of around 150 pesos per dose. And sabi niya, it was almost good to go. They were just hoping to get approval from the government. It never came.
That's not correct, because we're talking to Bharat, and that's the distributors of that is Ambica and Biotech of Enrique Gonzalez, and they're barely into their phase 3 trials at this point in time. So way back then, they were not in the picture yet. No, I mean, but yes, it is a good vaccine, and we are supporting the entry of Bharat here. And even that, the EUA is under process at this point in time. Mm-hmm. So yeah, I don't know if they were in touch with the right people. No, but these things take time, and the third phase trials are very important for what they call this FDA here to give the go signal. No, and now that they've completed the phase 3 trials only in this period, they are now In fact, they've allocated 8 million for the private sector. No, so I mean, and the phase 3 trials are just completed. So now I think the EUA will come out maybe after Holy Week, no, or before the end of before May. No?
But they seem to be having trouble with tripartite agreements, and they are saying it's easier. Well, we talked to Mr. Yuhuiko. He said he got help from the Indian ambassador, and they're getting help directly, I think, from the company. And they seem to be having problems with this tripartite agreement. Can there be a compromise?
No.
Are you talking to PCCI?
No, I am not working. I'm working with George Barcelon and the rest. No, I'm more familiar with the intricacies because we structured the tripartite agreement with AstraZeneca and Secretary Galvez. No, and it is a landmark. If you look at Mr. Razon, no? He's used the tripartite, and the group of Kishore Hemlani of Novavax and Clint and the Unilab people are also using the tripartite. And even Bharat, I've guided them that they have to use the tripartite. In fact, they asked our lawyer to help them go through the tripartite. And you cannot do it without the tripartite, I'm telling you that, because the government is the only one allowed to bring these vaccines in.